Today we are so excited to have the second day of competition in periodontology in Tbilisi, Georgia, 2025. And we have here our exceptional guest who participates in this amazing program. Well, Jonathan, thank you very much for the opportunity to make an interview and ask you quick three questions. First question will be about the future of periodontology and orthodontics. How do you see?
Well, first of all, if we think about periodontology, I think it's more and more going to power scaling, as we have seen already as a trend. Ultrasonic scaling, air polishing is taking more and more of the time. If you think of dental hygiene procedure, for example. Now we talk about the non-surgical perio treatments. However, hand instruments will always be there. There's always a need to get in deep pockets, narrow interdental spaces, and places where you cannot basically reach with a power scaler.
This is amazing. We understand the power of automatic cleaning and power of hand is much worse. What is the question of my audience, I believe, if future of robotic dentistry is going to take hand instruments and make cleaning better?
Of course, yeah, that's one possible scenario that you would have instead of a human hand, you would have a robot hand doing all the cleaning and maybe switching, all the time the kind of tip or blade which is being used. Another interesting thing would be for thinking about cleaning some nanorobotics, where you basically program nanorobots which can go in every space where it's impossible to reach basically with the current methodologies.
Wow, I didn't even hear about that. That's
Yeah.
so interesting.
Yeah, well, it's exciting. I know there's some in some US universities, they have done this kind of research already. I mean, it's long ahead of us, but yeah, some amazing things will be for sure if, possible in the future.
It's so interesting in the age of artificial intelligence and the hype of artificial intelligence, how you see is going to develop in orthodontics.
Okay, in orthodontics, I think first of all, already if you think about the developing technology of mobile phones and the cameras, especially in mobile phones, I think in even in the near future, and already it's possible to take by taking pictures with a mobile phone of your oral cavity, you can make several kind of findings. I think you can find caries. You will be able to, or you can already make diagnosis of occlusion issues, planning your tooth alignment, things like that will be possible for sure. And I think monitoring your orthodontic treatment, that's already possible with a mobile phone. For example, companies like Dental Monitoring, they have this technology available where the patient takes pictures at home. It's sent automatically through the cloud service, and the dentist doesn't even have to interfere because the AI is taking care of the communication and giving orders to the patient. Only if there's a complication that the AI cannot handle, the dentist or his assistant has to interfere and take contact with the patient.
Well, as of today, AI and robotic surgery is a matter of the future, right? And for now, in this moment, what do you think? Well, how can you comment the application you have with dental appliances for children? You already have an application, right?
Yes. So yeah, we have a mobile application. Basically, at this stage, the mobile application is only to monitor when it's the device is put in the mouth and when it's taken out. But I think in the future, with adding sensors to the appliance, it's going to be possible to measure, for example, a temperature sensor will be able to measure exactly how long it's been in the mouth, this device. And I mean, it could be possible to even measure what kind of forces the appliance is using on different teeth in real time. That could be possible through these micro or nano sensors. So there's really interesting things that could be ahead of us.
which I see like an objective method of measuring compliance of patient, right?
Yes. Currently, it's that measuring the compliance of patient, but I think in the future you can add some more, um, let's say, technological and features that will give better understanding also of the clinical function. If you can measure the pressure that the client is putting on in different directions.
This is very interesting. I hope we will have this conversation in future. And if you can, in the last question, just comment the situation of today's competition, the second day.
Ha.
We are so exciting.
Yep. Oh, it's very exciting for sure. With the second day of the Georgian Society of Periodontology Student Championship, and yeah, I think the students are now eagerly waiting for results of their exam, and then they will go to the hands-on session, and we'll see. So there's going to be two winners who win a trip to Helsinki University Summit. So yeah, very exciting times.
This is great opportunity for a student to go to Helsinki and see themselves with this support of these great companies like Saparus and Planmeca, right? They
Yes.
are going to see novel approaches in periodontology
Yes.
themselves.
Yes, there will be full blown program for 2 days. Different kind of subjects will be covered. Yeah, so there will be subjects in perio. There will be, you know, future clinical environment, how it's going to work from a digital perspective. There's going to be some new features around CBCT technology. So it's going to be a very interesting program, I believe.
Yeah, we were one of the first in Georgia who had an opportunity to use artificial intelligence for segmentation on computer tomography in version 6.8.4. And now in version 7, Planmeca is going to release artificial intelligence to all their apparatus, right?
Yes, yeah, that's correct. Yeah, and there's Planmeca is doing collaboration with some really prestigious AI companies like Pearl AI, and I think bringing together the best companies' technologies will give the clinicians the best tools that are on the market.
This is one of the greatest investment in future. So guys, I believe this is the best way to go. Right?
Yeah.
Thank you very much.
Well, thank you.
Appreciate it.
My pleasure.